This is CGTN, China Global Television Network.
The virus will not have a chance against us.
It's going to disappear. One day, it's like a miracle. It will disappear.
We lost our mother and her husband.
She deserved to live.
I can't believe that I didn't get the shot.
Today, we mark a tragic milestone here in the United States. 1 million COVID deaths.
Imagine the equivalent of the entire population of San Francisco gone in 2 years' time. That tragic scenario is now, unfortunately, a reality as America mourns the 1 million lives lost to COVID. 1 million. It is not just a cold, hard number. It is 1 million empty chairs around the family dinner table. For every 4 COVID deaths, 1 child will grow up without a parent. It is a neighbor, a childhood friend, or a co-worker. How did America get to this point? Was it an avoidable catastrophe? Or is America's, to borrow Francis Fukuyama, decaying political institutions and political culture had it coming? I'm Wang Guan. You're watching a milestone to mourn America's 1 million COVID deaths. It all began with misinformation in a politically charged season, something that later proved to be stronger than the virus itself.
The scientists have communicated pretty directly with the American people what to do. Sometimes some aren't willing to listen to the message. More often, unfortunately, somebody else decides to slant or skew the message or completely destroy it in ways that are untrue. And it's that disinformation, that misinformation that we're fighting right now.
One of the misinformation super spreaders was former President Donald Trump. He launched a campaign against science and common sense.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat. Because of all we've done, the risk to the American people remains very low. People die from the flu.
It turned out that the virus did not go away, and it was not just the flu. To vaccinate or not became a political question. Data showed Trump supporters were among those least likely to get vaccinated, according to Pew Research. Roughly 6 in 10 of those who relied most on Trump say they have received at least 1 dose of vaccine, while 38% say they have not received any. The most highly vaccinated groups are those who said they rely most on national news outlets and public health organizations. And the result? More death, tragically, in the so-called Trump country. Since May 2021, people living in pro-Trump counties have been 3 times as likely to die from COVID as those who voted otherwise. The WHO quickly noticed this vicious campaign against science and spoke out.
But we're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easily than this virus, and is just as dangerous.
An infodemic, the WHO says, causes confusion and, more importantly, risk-taking behaviors. It undermines trust in health authorities and slows the public health response. For example, in America, Fox News has been the highest-rated cable news network for as long as people can remember. And Tucker Carlson Tonight is one of its most popular shows. Check out this guy.
There are a lot of those people giving you medical advice on television, and you should ignore them. The advice they're giving you isn't designed to help, it's designed to make you comply. And you shouldn't comply mindlessly. You're an American adult. You are allowed to ask simple questions and then demand clear answers.
The anti-mask and anti-vaccine narratives directly contradict advice given by public health authorities. According to a new Kaiser Family Foundation survey, nearly 8 in 10 Americans are not sure about some of the major false statements related to COVID or vaccines. Misinformation gave rise to higher death tolls. A Brown University research showed 319,000 lives were lost after vaccines became available. Of course, one can argue about instances of breakthrough cases, but the Brown University research says many, if not most, of the 319,000 deaths could have been avoided with timely vaccination.
So when you have something that sweeps through the population at a very high rate of speed, you have to have many more people immune. Otherwise, the virus has no trouble finding a susceptible individual and starting a new transmission cycle. So that's, I'm afraid, what we're seeing now. Our failure to fully vaccinate our country has permitted Omicron to spread more vigorously. We now may be achieving herd immunity, but not the way that we wanted to. We wanted to achieve it through vaccination, and now we're achieving it with a terrible price of illness and even death.
Anti-mask movement in name of freedom and liberty swept the country.
It's horrible.
This is a revolution that's been needed for a long time.
In a restaurant in Florida, one can get free food if he or she is anti-mask. There are tons of supporters out there defending what they call their own medical decision.
What he is doing is standing up for the rights of people to make their own medical decisions, okay? And you know what? You want to call me selfish for not wearing a mask? I want to say to you,
Yes,
all the
Rachel,
people calling me
somebody
selfish,
snitched her out.
you're the one who's trying to force me a medical procedure so you can feel more safe.
To mask or not to mask, as if the controversy were not big enough, the Centers for Disease Control and Prevention updated its mask guidance in March, saying wearing a mask is no longer a mandate. More confusion followed.
It is confusing. It's worrisome to people.
President Joe Biden is backing up the CDC. It recommends people mask up in indoor public spaces if they live in areas with higher substantial transmission. That's most of the country. But only 8 states still require masks inside public spaces. And 5 of those say that'll change within the next couple months.
We believe that through the Department of Health, through all the data that we have, that we're trending in an area that's going to be very safe for our local districts to make up their decision.
The mixed messages leave a lot of people confused.
The reason why we have lost 1 million people in this country is because of that fight against human stupidity. I can tell you that the number of deaths that we would have been much more smaller if people just listened and did the right thing, if they had a little bit of common sense.
Every person is entitled to their own medical decision, or so some on the political right argued. While the politicization of mask wearing and vaccination continued, the virus transmitted and mutated non-stop through an exponentially infected population. A burden borne by none other than the country's medical workers.
As soon as we move one out, it's going to be filled almost immediately for another patient. And so we have people going above and beyond, but they are exhausted, just exhausted.
A shortage of personal protective equipment, or PPE, has made things worse since early 2020. Some people even used college graduation gowns for protection.
To hear these personal stories of people on the front lines that have nothing, that are begging for gowns, that are begging for any support that we can offer them and as fast as possible.
Qualified nurses! Hire more nurses!
Widespread stress and burnout, health and safety issues, depression and work-related post-traumatic stress disorder. As a result, nurses are quitting in droves all across the U.S., with 62% of hospitals reporting nurse vacancy rates higher than 7.5%. Rising demand and shrinking supply are forcing many U.S. hospitals to pay top dollar to get that much-needed help, if they can afford it, of course. The country's healthcare relies increasingly on travel nurses who can fill in when needed, at a price. Up to a whopping $5,000 or more a week. It weighs down on those hospitals that provide healthcare to the bulk of uninsured, low-income patients. And to add insult to injury, some U.S. hospitals have been forced to ration healthcare provisions.
We have had situations in here with COVID, with people this critical, where two people start to go bad at once. And you have to decide which room you run to. It's a hard decision to make.
Healthcare rationing has always been a reality in the U.S., and it's de facto rationing when patients are discriminated against because they can't afford out-of-pocket costs or simply because they live in rural, remote communities. However, according to Kaiser Health News, some of the richest nonprofit hospital systems raked in millions in surplus in 2020 due to lopsided federal healthcare bailout grants, a recipe for disaster as richer hospitals got more and poorer got less.
1 million lives lost in the U.S. during this COVID pandemic, and the real death toll could be higher. In the world's #1 economy and the so-called shining beacon of hope, why do ordinary people perish with little to no protection? Why haven't the country's safety protocols worked? Why is the healthcare industry booming while people suffer?
I was watching the news in the beginning. They were like saying, oh, don't worry about it. If you contract COVID, we're paying all the bills for you.
Janet Mendez, a New York resident, was infected with COVID-19 in March 2020. But it turned out that the government did not pay. Her hospital kept sending her medical bills from different departments for various procedures and treatments, and they added up to an astronomical $400,000. Janet did not understand why she owed so much. After a news report on her plight, the hospital found a billing error, admitting that what Janet really owed was just somewhere between $6,000 to $16,000. Janet is not alone. The Medical Billing Advocates of America says that 90% of hospital bills contains at least a minor error. One of the biggest critics of the U.S. healthcare system is U.S. Senator Bernie Sanders.
5 major drug companies last year made $50 billion in profits. They have well over 1,000 lobbyists here in Washington, D.C. They provide hundreds of millions of dollars in campaign contributions. Their job and what they do is charge the highest prices they possibly can, the highest prices in the world. Their business model is greed.
The right to health care, as one of the most basic rights, says everyone should be entitled to it regardless of race, age, ethnicity, or social status. But how can this basic right be respected when some 14% of Americans quit treatment just because they couldn't afford it? In this global catastrophe, who is getting the gold?
The healthcare system, it's not made for the people. It's not made to keep you healthy. It's not made to help you in any way. It's certainly not made to help you pay your bills, right? It's a for-profit system.
It's understandable that hospitals operate on a for-profit basis, but the question is, by how much? By the end of 2020, HCA Healthcare, America's largest for-profit hospital system, posted a $3.8 billion profit, more than it made the year before the pandemic. And others are getting a slice of the action. Tenet Healthcare, a multinational healthcare services company, made almost $400 million in profit. The University of Pittsburgh Medical Center and the Mayo Clinic also raked in hundreds of millions. It is a gold mine and a cash cow for other healthcare-related industries as well. As employer-sponsored health insurance is exempt from income taxation, 9 out of 10 privately insured Americans are covered by plans purchased by their employers. But as shown in Michael Moore's documentary Sicko, people have to ask whether the scheme is good for employees.
Okay. Being that I'm an employee here, my medicine is for free, so that's why I got to keep working until I die. There are golden years, I can't find them. I'll tell you that.
And for those who have been laid off, not only did they lose their jobs, they were no longer covered by a social safety net. While people are suffering due to COVID and footing the bill whether they can afford it or not, big pharmas, including but not limited to vaccine manufacturers like Moderna, Pfizer, are making a killing through the benefit network behind. Queen Nystrom is a diabetic, and the huge amount of insulin she spends every month makes her breathless.
Today I went and picked up my insulin prescription. That retails for $340 a vial. I go through 2 to 3 vials a month. So how are normal, everyday working class people in this country supposed to afford to keep themselves alive?
And she is not alone. In order to survive and to prove a point, a group of diabetics decided to break the law. They chartered a coach to take them across the Canadian border some 1,300 kilometers away to buy cheaper insulin.
These vials of insulin in America would have cost me $3,060 retail price. That's in US dollars. Today, I paid $243. It is staggering how much more money it is in America. You can see why 1 in 4 Americans are rationing their insulin because they can't afford it.
According to John Gaiman, a member of the Institute of Medicine, the COVID-19 pandemic has exposed long-standing system problems of U.S. healthcare, ranging from access barriers, uncontrolled prices and costs, unacceptable quality, widespread disparities and inequalities, and marginalization of public health. The pharmaceutical industry is not a fully competitive market. Patents mean that these companies have legal monopolies on specific drugs, and a 20-year patent term does not necessarily mean access to a free market.
Products that are out are not really new. They may have tweaked the manufacturing process and the like, and they have better delivery pens and the like, but the increase in price has been astronomical.
Besides production, distribution channels in the U.S. are complex, if not opaque, and involve multiple institutions and intermediaries. Everyone, it seems, wants a piece of the pie. Due to the implementation of free pricing legislation, manufacturers, wholesalers, and pharmaceutical benefit managers, or PBMs, have joined hands. Although PBMs are not part of the distribution channels, they've been granted substantial influence, such as reviewing doctors' prescriptions, formulating prescription sets, negotiating drug prices, and so on. According to Eversana data, in 2017, the top 3 PBMs were responsible for 73% of all prescription drug sales in the U.S. This mechanism has friends in high places. According to statistics by Open Secrets in 2021, the Pharmaceutical Research and Manufacturers of America, the American Hospital Association, and the American Medical Association rank among the top 10 agencies with the highest lobbying expenditures and spent nearly $75 million to protect their interests. The whole industry is trapped in a vicious cycle. No matter which political party is in power, with interests intertwined, it is unwilling to rock the boat.
1 million lives lost in the U.S. during this COVID pandemic, and the real death toll could be higher. In the world's #1 economy and the so-called shining beacon of hope, why do ordinary people perish with little to no protection? Why haven't the country's safety protocols worked? Why is the healthcare industry booming while people suffer?
In America, COVID hasn't affected every person the same way. The age-adjusted COVID death rate showed Black and Latino Americans are dying twice more likely of coronavirus compared to whites. The situation is worse for Native Americans and Pacific Islanders. Now, many factors are contributing to this huge gap, but one underlying reason is systemic racism.
The extraordinary disparities we have in health, where in our country, similar to other disease, a vastly disproportionate amount of suffering among our brown and Black people, our minority population, in which the incidence of their getting infected is much higher. Their degree of hospitalizations, intensive care, and death is significantly higher than the general population.
Another factor is vaccine hesitancy among certain communities who have been historically wronged by medicine. What does that mean? Well, take the Tuskegee syphilis study, for example.
In Tuskegee, Alabama, during the 1930s, 399 poor black men with syphilis were studied without their knowledge or consent and withheld treatment for decades. The experiment continued until the 1970s, when it was revealed in the press and shut down. Of those 399 black men in the study, 100 or more died of syphilis or related complications. Others went blind. At least 40 of their wives were infected, and 19 children contracted it during childbirth.
The distrust of the government and healthcare system among African Americans get passed down from generation to generation, and they collide squarely with COVID-19 vaccinations.
And so when you have someone say to you, oh, no, I'm not taking that vaccine because I remember Tuskegee, it's like this historical memory that African Americans have of experimentation on black bodies.
For Asian Americans who recorded the lowest death rates in the pandemic, their lives weren't any better as COVID-19 fuels anti-Asian hate. The FBI recorded a 77% increase from 2019 to 2020 in hate crimes against people of Asian descent. According to Stop AAPI Hate, a California-based coalition that tracks self-reported incidents of harassment, assault, and discrimination against Asian Americans, there were over 6,000 cases in 2021, up from 4,600 in 2020. Studies also show that Americans living in poorer counties died at almost twice the rate of those in rich counties. According to the Poor People's Campaign, the 300 counties with the highest COVID death rates in America have an average poverty rate of 45%, and with household median incomes on average $23,000 lower than counties with lower death rates. Now, William Barber, co-chair of the Poor People's Campaign, said, and I quote, "The neglect of poor and low-wealth people in this country during a pandemic is immoral, shocking, and unjust, especially in light of the trillions of dollars that profit-driven entities received." The impacts of COVID on families are not just financial.
His wife is a single mother of 4 kids. She was a stay-at-home mom before, but is now looking for jobs in order to have more money to take care of her children, who are only 7 years old, 6, 4, and 1. The baby girl, Paisley, could point to a picture of her father and say Dada, but the reality of him no longer being here is hard.
That's what we've been doing. I've been, showing her pictures so she knows where her daddy is,
Hearing 1-year-old Paisley call for her father breaks Emily Bennett's heart. 7-year-old Mackenzie cries too, followed by 4-year-old Savannah. 6-year-old Easton is comforted by his mother as they reflect on the loss of a husband and a father, Chad. He died on a ventilator from COVID July 29th.
I called the hospital to see if I could bring the kids up so they could tell their daddy bye one last time. I couldn't come up.
According to the White House, more than 200,000 children in the United States have lost a parent or caregiver to COVID-19.
What happens once a child has lost a primary caregiver? Well, the first urgent thing that we have to do is make sure that they don't go into an institution. There is very strong evidence that orphanages, institutions have very much higher rates of abuse, of sexual exploitation, that children's long-term outcomes are much more difficult. And so what we have to do is find them family homes, ideally within their extended family, but to support families to look after these children. They'll be recently bereaved, they may be out of school, they need extra support, parenting support and economic support within that family.
As the U.S. mourns the 1 million lives lost in the pandemic, cases and hospitalizations are spiking again. In mid-May, cases in America have climbed 60% in 2 weeks, and hospitalizations are up 20%.
The White House COVID-19 response team and federal public health officials gave new warnings about the coronavirus pandemic on Wednesday. Centers for Disease Control and Prevention Director Rochelle Walensky said the U.S. has seen a new steady increase in COVID-19 cases over the past 5 weeks, and numbers are up 26% nationally from last week.
And without additional resources, we will find ourselves in the fall or winter
with people getting infected and no treatments available for them because we will have run out.
The problem we have is this illusion or deception that the pandemic is over, when in fact these variants that we're seeing are coming at a much faster clip. There's an accelerated evolution of the virus, and these are more troubling variants. They're not more mild. In fact, they have a more immune escape. So they're transmitting at levels that is really inconceivable and starting to approach the level of measles, one of the most spreadable pathogens we've ever encountered.
There's something else that we've talked about, and that is post-infection chronic syndrome. Many people who get the disease naturally run the risk of some later lung disease, heart disease, kidney disease, or brain disease, what's often called long hauler syndrome, and that doesn't seem to go away very well. So hopefully we've learned an awful lot about how to manage the disease because we're not having the same death rate we had, but as you have more people getting the disease, either for the first time or over again, it will spread and some people will get sick. Vaccinations and natural immunity reduce the likelihood of severe illness and death. And until deaths begin to increase, we're not likely to see an aggressive response. And, we're not going to see an easy national response because public health in the United States is generally not a federal issue. It is state controlled. Every state, like the Constitution, is really responsible for managing its own public health.
$1 million lives lost is a tragic milestone. It made many reflect on why and how this happened to America.
I always just think about was there something else that I could have done.
Should people blame one particular president?
Anyone who's responsible for that many deaths should not remain as President of the United States of America.
Or should they reflect on some deeply rooted issues? Polarization in politics, widening inequalities.
They tend to get sicker more quickly.
And they became public health system.
This year, I've definitely put a lot more people in body bags than I would like to in my whole lifetime.
Fact is, the virus is not done yet. If the pandemic has taught us anything, that is, we must put aside ideology and let science be science. And that we must not let geopolitics trump cooperation. Because however you look at it, our common stakes are higher than our differences. Thank you for watching this special episode. I'm Wang Wen.